Good evening. I'm Dr. Sandhya Saharan, the Joint Secretary of the Polycystic Ovarian Syndrome Society of India, and I welcome you all to this webinar on the role of environmental factors in PCOS. As we all know, polycystic ovarian syndrome is something which has become the bane of society and healthcare in general. So in order to shed light on this topic, we have a panel of experts who will be discussing the various enigma which this disease portrays, and we will understand what it is all about even better and how we can deal with this syndrome to the best possible. With that, I would like to share the video by our founder president, Dr. Shah, about the Polycystic Ovarian Society of India.
Welcome to the PCOS Society of India. As a founder president of the organization, I welcome you all to be part of our organization, which is a multidisciplinary organization consisting of specialists and experts from various fields of medicine who look after women with PCOS and even young girls and even children. Our organization is focused on education of the doctors and education of our patients. With the recent Vijayata program, which we have created through the support of Philips India, we are reaching out to women all over the country. And I request all of you to be part of this program, to take this complete agenda nationally and to educate our women on how they can prevent complications for themselves in future. I also request you to become our members, because that is what is going to help you in updating your skills in this field, which is really a very growing area of treating women and preventing problems in future. Thank you very much, all of you who have been with us, and I look forward to interacting with you in many, many more programs to come.
That was our founder president, Dr. Shah. She is the leading pioneer in the field of PCOS and also an infertility expert. She also helps to frame the guidelines for PCOS worldwide. With that, I'd like to introduce our esteemed panelists. This discussion is conducted under Vijayata, the winner, as Madam has just said, and it is an outreach program by the PCOS Society of India. This is myself. I have been the past president of the Thane Obstetrics and Gynaecological Society, and currently I am the joint secretary of the PCOS Society India and also chairperson of the midlife committee of the Maharashtra OBGYN Association. And I consult at Jupiter Hospital, Thane, LH Hiranandani Hospital, Kaushalya and Cure Hospitals in Thane. Apart from that, I do have other interests in acting, singing, trekking and organic farming. And today, let me see that we are going to have this discussion with our panelists. The first is Dr. Chaitanya Ganapule. He is a diploma in gynec endoscopy from France, Germany, certificate in IVF from London. He is the chairperson of the Endocrinology Committee, FOXY 24 to 26, Zonal Coordinator, AMOX 24 to 26. Director of the Pearl Women Hospital and Yash IVF, Pune. Director, Yash IVF, Hadapsar, and Satara IVF, Yash again. Recipient of the Times Health Icon 2020. He is an invited faculty and has publications in national and international journals. He has written chapter in Jeff Cott's textbook of gynecology, a very, very renowned textbook, Foxy Focus and others. Welcome, Dr. Ganapule.
Thank you, Dr. Sandhya.
Most welcome. Then we have our other panelist who is creating a lot of waves in the world of nutrition, Mrs. Simmi Shah. She is a postgraduate diploma in clinical and community psychology, Master of Science, Dietetics and Food Service Management. She is currently the consultant dietetics and patient educator at Jupiter Lifeline Hospital, Thane. She's also associated with antenatal nutrition, namely Bud Nourish, nurses training programs, panel member of a heart failure clinic and heart transplant team, facilitator of cyclic education programs, and her other interests are in fitness, and she also participates in marathons and runs for medical charity causes, also cycling and trekking. Welcome, Simmi.
Thank you, ma'am.
Our third panelist is Dr. Prajakta Gupte. She's a consultant psychiatrist at Jupiter Hospital, Thane. Her area of interest is liaison psychiatry. She's undergraduate from KEM and postgraduate from Nair Hospital, Mumbai. Fellowship with Royal College of Psychiatrists from UK. She's also attached to Jupiter and Bethany hospitals in Thane for the past 17 years. So with this welcome, I'd just like to say PCOS is an acronym for Polycystic Ovarian Syndrome. Many people also say Polycystic Ovarian Disease, but now it is termed as syndrome. The names keep changing time and again with various guidelines coming in. 1 in 5 Indian women suffer from PCOS. It can occur at any age, starting with the first occurrence of menstruation. Majority of women are diagnosed between the ages of 20 and 30 years, and it is the frequently observed cause of female infertility. With this, I would like to start the first question. I'd like to direct it to Dr. Chaitanya. What are the main diagnostic criteria for polycystic ovarian syndrome, and how do they guide the clinical management? Dr. Chaitanya.
First of all, I would like to thank the PCOS Society and Dr. Sandhya for inviting me and making me a part of this wonderful panel discussion and the awareness program which we are conducting. Coming back to your question that what are the major diagnostic criteria for PCOS? Now, when we say diagnostic criteria, I would like to divide them into two. One is the symptoms or with which the woman presents to us, and the investigations what we do to confirm the diagnosis. Okay, so when it comes to the symptoms of a woman, most of the women who are suffering from PCOS would have irregularity in the periods or menses. So that is the first symptom which should arise a question mark in our mind whether she is suffering from PCOS. Now, when I say this, we have to be a little careful here, because immediately after one starts having her menses or menarche, for the first few years, the menses are going to be irregular, and that's not the time when we take this as one of the criteria for the diagnosis of PCOS. But otherwise, irregularity in the menses is the first criteria which we look for. Then other symptoms with which usually the woman can present to us is hirsutism or acne or alopecia or excessive hair fall. So these are all again symptoms which tell us about excessive androgen levels in the body. Now, these are the symptoms with which usually the woman presents. Now, once she presents to us to confirm the diagnosis, we usually do tests. Most of the commonly done tests are the ultrasound and the blood tests. So on ultrasound, we see polycystic appearing ovarian morphology. So if that is the case, and along with that, if you have the irregularity in the menses or the blood test which tell me about the biochemical hyperandrogenism, if we have two of the three criteria met, then that's when we diagnose that the woman is having PCOS. Just polycystic appearing ovarian morphology again is not the diagnostic criteria for PCOS, because that's the very common thing with which a young girl usually presents to us in our clinic with an ultrasound report. Doctor Saab, hame PCOS hai. And when we ask them, how do you know that you have got PCOS? They say, ye kya? Ultrasound mein likha hua hai. So that's not the diagnostic criteria every time. So we need to differentiate between the two a little bit. That's what I would like to say for this when it comes to diagnosis.
That was very elaborate, Dr. Chaitanya. In fact, I was going to bring out this point that, young girls They come with ultrasound reports. So we have to tell them that within 8 years of achieving their first menstruation, that is menarche, generally we do not advise ultrasound unless, we feel that there is something else we need to look at.
Correct.
So that is very important. And also I'd like to tell our delegates that if they have any questions, they can write it in the chat box, because we'll be taking the question and answers in the end of the session. So with that, Dr. Chaitanya, you've set the ball rolling, and I think that was amazing, the entire description. Now to Dr. Simmi. What is the reason behind the increased incidence of PCOS? We are seeing a lot of people, initially we saw one in, say, a week or two when we started practice almost 30 years back. Now I'm seeing almost 1 or 2 a day. So what are the lifestyle and occupational risk factors which you feel could be contributing to the increased incidence?
Yes. Thank you, Dr. Sandhya and PCOS Society, for inviting me as a panelist for this awareness program. So I would like to say modernization and urbanization, So like if we talk about upper middle class or upper class strata, economic strata, we all have like maids, cooks, nowadays even robots at home. So we hardly have anything to do physically, the household chores. Then on top of that, we have dishwasher, washing machines, dryers. So almost nil physical activity or minimal physical activity with dough maker, roti maker, khakra maker, everything. Secondly, there is a mind frame of creating own identity. So these days, everyone wants to work in the office. The homemaker or housewife thing has been looked upon at little ki, "Arey, aap kuch nahi kar rahe ho, sirf ghar pe hi ho karke," and it's been considered as worthless and thankless job. And then if we talk about office, and if we talk about the cities like Mumbai, where there are so many long commuting hours, and generally it's a desk job. So just sitting on chair, for so many 7 to 8 to maybe 10 hours in a day. And sitting, as we all know, has been considered as a second smoking. And adipose tissues have been very accommodative. I mean, the chair, the comfortable chair, it takes up the shape of our hips, that. So that is very contributing factor. And we do meet up, we try hard to meet up the targets, but we do not try hard to meet up our exercise regimen. Our sleep cycle has also gone for the toss. We may argue that, okay, when we sleep for 7 to 8 hours, but that is not important. It's important to get that quality sleep between the hours of sunset and sunrise. So that's very, very important. So we have disrupted our circadian rhythm as well. Then the third thing is digitalization. So mobile, TV, OTT programs, they have made us couch potatoes, and this social media. So now life has been, lived for social media. So women have been spending a lot of time in beauty parlors in order to look picture perfect, because everything has to be reeled. So that is also contributing. Then over socialization and multiple small celebrations, which never used to be if you talk about 3 decades back. Now every small things we have been celebrating, and there is always, it revolves around the food. Like how the earth revolves around sun, our all social celebrations, they revolve around the food. Then triple A's, excessive affordability, availability, accessibility. So we make wrong choice by convenience packaged food, ready to eat foods, and even gravies, fast foods like pizza, burgers, all these things, getting carried away by advertisement gimmicks, not reading nutrition labels, then industrialization and technological advancement. So with this, it has given rise to HFSS foods. That's high in fat, sugar, and sodium, and they lack in fiber and healthy fats. Then it results into the obesity, which is both. It's a symptom and a cause as well. So the obesity leads to hormonal changes like early adrenarche. So it leads to the increased level of androgens, which interfere with development and release of egg, which is a hallmark of PCOS. So obese girls are more likely to get PCOS as a teenager or as a young adult. And this obesity could also be a forerunner for the metabolic syndrome, giving rise to insulin resistance, hyperinsulinemia, dyslipidemia, and higher levels of androgens produced by ovaries, which are the most common other symptoms observed in the PCOS. Hence, healthy literacy gap advice is very important for the people who usually have suboptimal risk inception and intrinsic motivation. So
Oh
these
my
are
God.
the factors that are playing roles.
That was very elaborate. In fact, I think the whole picture of PCOS has been completely, you can visualize the whole thing. Sedentary lifestyle, and even children.
Yes.
They are mostly on their gadgets. It's so sad to see, that children are not playing what we used to when we were children, but they are just playing on their gadgets. So this is something
Yes.
very sad. And I think all this leads to, mental health issues, because there are, I think, a lot of increased incidence of mental health issues in PCOS, and we have Dr. Prajakta with us. So, Dr. Prajakta, what is the prevalence? Do you see an increase, and what are these mental health issues which are faced by, women with PCOS?
So yeah, thank you, Dr. Sandhya, and thank you for inviting me for this talk. So if you think even for regular people, say if you look at younger women, there is a huge pressure, societal pressure now for appearance, for performing, for social interaction. So all the time. So if you think of younger people, when we were younger, say in our teens, late teens or early 20s, and now I think life is more difficult at present with all the time in the limelight, having to perform on various fronts. So if people with good health are able to have this pressure, then can you imagine somebody who is obese and who's hirsute, who has excessive hair on her face, and who has acne and irregular menses, as in irregular menses must be taking a toll on her for many years, where it is not even a discussed topic, or if it's early years, then it may not be even taken any medical help. So all this really takes a toll. So PCOS is a chronic condition. So in any chronic illness, say if you think of CKD or heart disease, diabetes, so prevalence of depression is seen to be around 40%, which is not picked up. Or this, I'm just digressing a bit. Say if you look at CKD, just the lack of energy, lack of motivation may be confused with uremia and is, written off and taken as part of CKD. ये तो होता है. So in the similar way, if I think it is thought to be natural that yes, if you are overweight and if you are having insulin resistance marks on your body, and if you are having acne, then obviously you are going to feel low. So it is taken as part of it, and nothing needs to be done. I mean, first improve the physical characters, and then your mental health is what is thought. But it is so difficult to improve, say, lose weight or exercise or motivate yourself, that it's a vicious cycle. So if you look at it, depression is around 30 to 40%, and anxiety is in similar. Around 25 to 40% of people are very anxious because this is in addition to the regular academic or social interaction that they need to do. There are other psychiatric illnesses that are seen, say bipolar. PCOS is seen to have some bipolar concurrence, also some eating disorders. So there is lack of pleasure. So they may find pleasure in food, trying to, and that again, it's a vicious cycle. So again, a weight gain cycle, and maybe risk for diabetes, risk for other metabolic factors, and again, a poor, low self-esteem. So they have a lot of body image concerns as well. So many times they may have features of body dysmorphic disorder. So excessive watching in the mirror, excessive, going at lengths to try to improve your appearance. So these are some of the commoner mental health issues that people with PCOS go through.
So do you in your practice also come across these eating disorders like bulimia or anorexia, girls trying to have that zero figure and all those kind of things, those you must be coming across?
Yes. So I think now, which is very surprising, because usually eating disorders was not seen very commonly. It is usually in the affluent was thought to be a illness of the affluent, but now in our regular OPDs, you see young girls and they go at great lengths. So I may have a young lady, college going, who has gone to great lengths to hide her eating disorders, as far as hiding herself in the society clubhouse, so that she's not found, because her mom was tracking her. Why is she not eating? Why is she missing meals? So people go to great lengths because I think the pressure is too high.
Yes.
And that takes a toll.
That's really sad. This is really very, very something which is very, we need to take cognizance of these things. So, Dr. Chaitanya, everybody has enumerated that, we see a lot of menstrual irregularities, and especially in these younger girls, especially the adolescent age group or the very young girls, where we say that, yes, a little bit of irregularity is normal. But many, mothers come with their girls that the periods are not coming on time. There's problems at school, college, and even women who just get married. Sometimes they find it very difficult that every time checking whether they are pregnant and all those. So these problems, how do you counsel them, and how should they be managed?
Okay. So before going on to that, as I would just like to add a couple of things to what Dr. Prajakta just said, that all of that what she has said is so true. But the thing is, we as gynecologists should also, look at that aspect of PCOS. So whenever a girl comes to us and we diagnose her of having PCOS, we should look into her mental well-being as well. We should look into the mental health as well, because that's the probably first point of contact wherein, we have the chance to diagnose that mental being unhealthy and refer them to Dr. Prajakta or whosoever deemed necessary. So with that, let's come back to your question. As you rightly said, many of the adolescent girls come or their parents get them to us for the irregularity in the menses. So the first thing what I counsel them is that for how long she has been since her menarche. So as you said in the first question, that for 8 years, up to 8 years, the irregularity in the menses could be a physiological transition from menarche to getting her menses regularly. So their assurance to the girl and to the parents is all what is needed. So she may not need any pharmacological treatment for that. So counseling becomes a very important aspect of the management of PCOS. But at the same time, we should look at her other aspects, like whether she is overweight, whether she is obese. And if that is the case, we should definitely counsel her about the ill effects of being overweight or being obese, and how we can or what we can do to get her BMI back into the normal range. So we may not start her on any pharmacological treatment, but we should be counseling her for weight loss with the help of a healthy diet, with the help of a proper exercise, and at the same time look at her mental well-being. But if she has already crossed the age of adolescence and still she is having irregularity in the menses, that means somewhere at the back end she is not ovulating because of the hormonal imbalance. Now, what do I mean by ovulation is every month one egg is developed in the ovary and that egg ovulates. And this is all the system which is developed by the nature for reproduction or procreation, right? So at the back end, there is no ovulation, and that is the reason why she doesn't get her periods regular. If she is not having ovulation, that means she is not getting progesterone hormone. So there are two hormones which come in any woman's body. One is the estrogen, the other one is a progesterone. That means every month she is getting estrogen, but she is not getting progesterone. Now, these two hormones are acting against each other. So one is for the development of the endometrium, while the other stops the development of the endometrium. Both of them are equally important. So if she is not ovulating and there is an unopposed estrogen action, probably I would put her on progesterone supplement so that the unopposed estrogen action is countered. So sometimes we do need to have pharmacological actions, but not always we need pharmacological actions. Counseling, reassurance to her and the parents, and as I said, weight loss if she is overweight or obese, and the mental well-being all needs to be looked into.
Sometimes they say, no, even 5% of weight loss,
Yes.
especially in obese PCOS, if there is even 5% of weight loss, sometimes we see within 3 or 4 months that the menstrual irregularities are rectified to a larger extent.
Absolutely.
So, yes. So I think that is the main thing which we as gynecologists should reinforce, that it is not always that some just one pill and then everything will get okay. So
absolutely. And when I say, and when I say weight loss, her weight loss is the responsibility of the entire family.
Family, absolutely.
It's not only her responsibility, but it's the entire family. I mean, how is it possible that you all are eating pizzas and burgers and you are asking, you should not eat, you have to lose weight? It's not possible. I mean, even if she doesn't eat it physically, the mental, trauma which she goes through itself might put on weight.
Yes, absolutely. So with that, Simmi, we see so many schools, though of course, Dr. Durusha and most of the PCOS society, we have been writing letters to the central government also that in the canteens, especially in schools and colleges, junk food, vada pav to a large extent should, be stopped. Or at least, you should find healthier alternatives because there is so much being spoken about gut dysbiosis, eubiosis, the connection with PCOS. So could you just explain a bit like, what is all this gut dysbiosis which everybody is talking about, which can be, attributed?
Yeah, sure. So, as we all know, trillions of microbes reside in the human gut. They may outnumber the human cells, And if they remain in the eubiotic state, then it will exert the beneficial effects on the human host. But if they go into dogma state, that is dysbiotic state of gut microbiota, then they will have the harmful effect on the human host. So this dysbiotic state of gut microbiota has twofold physiological links. One, as we discussed, there is a lot of consumption of fast food, junk food, which is high, like HFSS foods, right? So they lack in fiber and healthy carbohydrates, healthy proteins and fats. So when they lack in fiber, dietary fiber, what happens is this dietary fiber is not digested in our small intestine, but it is digested in the colon, large intestine, and it produces SCFAs, that is short chain fatty acids. Especially butyrate is very beneficial. It serves as the food for the colonocytes, and it also maintains the epithelial integrity of the colon cells. So that is one effect. And another is with the consumption of the long-term consumption of these kind of unhealthy foods, we produce more of gram-negative bacteria, or what we call as bad bacteria. Okay. So these bad bacterial cell wall, they contain a substance called leucopolysaccharide, which is a powerful immunostimulant. So, and if you are consuming these kind of unhealthy foods, then your epithelial integrity is also not so good. Okay. So through this leaky gut, this LPS, which is a harmful substance, it could enter into the circulation, which will cause metabolic endotoxemia, leading to a low-grade inflammation. Okay. And it also causes disruption of insulin receptors. And this is how it results into insulin resistance and hyperinsulinemia and increased ovarian production of androgen, halting the normal ovulatory process. So this is how this dysbiotic state of human gut has the negative impact and the negative correlation with PCOS. So in order to maintain eubiotic state, that is good state, well-balanced state of your microbiota and your gut health, your food should be consisting of prebiotics. Like when I say prebiotic, it means dietary fiber, complex carbohydrate, which are present in whole fruits, vegetables, whole grains, whole grain flours, millets, barley, nuts, oilseed, oats, etc. And you can combine them with probiotic food examples like curd, buttermilk, lassi, fruit lassis, fermented beetroot kanji, ghar ka bana hua makhan, fermented food, all those things. So when you combine them, they become symbiotics. So they exert the very good effect on human gut. Then healthy fats like PUFAs, polyunsaturated fatty acids, or omega-3, which are present in fish like salmons, tuna, sardines, then fish oils, then nuts like almonds, walnuts, oil seeds like flax seeds, til seeds, chia seeds, वगैरह में, pumpkin seeds, वगैरह. So your diet should be containing all these things. Then phytochemical flavonoids and non-flavonoids, which are present in citrus fruits, soy, turmeric, dark chocolate, coffee, etc. They also produce short chain fatty acids, which serve as the food for the colonocytes, and they maintain the epithelial integrity. And they also help manage weight, your lipids, your triglyceride, and they act as cardiometabolic protectors. And I would like to focus upon the resistant starch also over here. So legumes, seeds, whole grains, then the fruits like raw banana, which are hard on digestion, or the cooked and cooled rice and potatoes, or rice mixed with ghee, so carbohydrate mixed with some fat, they are more resistant to digestion in the small intestine, and they get digested into the large intestine, and that is how they also provide as a food for the colonocytes, and they also help maintain the large intestine epithelial integrity. So these for all food should be included in your diet to support your gut health, promote satiety, better glycemic control, and improved insulin sensitivity. So this is what
I really feel like taking notes when you're talking. It's so informative. Only one thing I wanted to ask you: many patients come to me, and
yes.
you know how it is. They keep going to multiple doctors, and they take opinions from everybody. Ye khao, wo nahi khao. So they say PCOS means absolutely no dairy. So I wanted to understand, because probiotics, when we say that we do. So what is this thing like, is it a type of dairy, or is it absolutely no dairy or something, there's inflammation is definitely a marker. So nowadays the thing is, the latest fad is that dairy causes inflammation. So what
There
is
is
your
not
take?
a very strong scientific studies to support this. And when you remove the whole major basic food group from your diet, it is definitely going to, cause some deficiencies. And if I talk about the vegetarian population, then dairy products are a very good source of first class protein as well as calcium for them. And if you remove that, then that is definitely going to be the deficiency. And then what about the probiotics like curd, buttermilk, वगैरह?
Right.
So you can just check the quality. You should be buying from the reliable vendor, where you get the pure milk, pure cow milk, or it's not the adulterated milk, and that's how you can. So the basic thing is have everything in moderation.
Great.
Don't remove the whole basic food group from your diet.
That's great. Very, very important take home point, I think. Don't
Yes.
absolutely isolate all this, but then have it in moderation. So, with that, I come to Dr. Prajakta. You said there is a lot of depression which you see among women, a lot of eating disorders and all. So, how do you identify these red flags? And, is there anything like interview, the specific points? We hear so much about motivational interviewing. So how do you go about all this?
So red flags are, say, if in any of the younger population, if you were to see somebody who has obesity or who has hirsutism or who has a lot of acne, then yes, these are hallmarks of PCOS, and I think there has to be enough screening. I think in maybe college populations, but for screening or for them to be even able to pick up maybe the college and the faculty, and there should be general awareness amongst the people to be able to come to professionals. If they were, say, once PCOS is diagnosed and there is obesity, then a lot of one big thing that is lacking is motivation, and I don't think it is lacking. I think there have been enough efforts at a particular thing, say maybe losing weight, and the person has tried, or the lady has tried on her own or with help multiple times, and probably some sort of fatigue or poor results are the demotivating factors that really after some time doesn't allow her to try anymore. So motivational interviewing is a technique that is used very commonly for any kind of repetitive behavior. So any addiction, say smoking, alcohol, or weight loss. So what we do is basically we are trying to see where, so there is a Prajakta and De Clementis cycle of 6 stages. So you need to see where your patient is placed, at what stage. So if that person, the first stage, what we call is the pre-contemplatory stage, where I have not even thought that I need to lose weight. I understand that I'm obese, but I cannot, I need to have some medications. I cannot, I don't think I need to do anything about the weight loss. So I'm in pre-contemplatory stage. So if the doctor tells me that I need to go and walk, I need to eat selective foods, miss out a few foods, then it is not going to, percolate, because I don't think that is required. So one is the pre-contemplatory stage. So if that person is in this stage, then you need to find out, give her some scientific basis. So this is what the studies say, and then maybe weight loss needs to be one of the agenda. And what do you think is stopping you from considering it? So that kind of conversation may be required. Second stage is contemplatory stage. I know I need to lose weight, but yes, I have never really got to it. So then you need to sit with her and talk about what are the hurdles. Say when I get up in the morning and I want to walk, I decide that I have to walk, but I don't get to it. So then what are the hurdles? So whether it is poor sleep at night, or having to rush to work, or a lot of academic work, or just poor motivation, or I get tired easily, whatever it is. So whatever task has to be broken down into small achievements, and like a baby steps, and given it to them to make it easier. The third is, yes, I need to lose weight and I'm going to do it now. So I'm in preparatory stage. I'm ready to do it. So then how do I do it, and what I need to do? Can I do 3-4 hours in a day, once a week, or I need to do consistently? So then you need to give education on what is regular, at least half an hour every day. So of consistent work. So that kind of some directives need to be given. So the next stage is action phase. So where I'm doing this, and so what is the aim? How much weight loss is required, and at what speed, and what are the ways you're doing it? Are you like starving to do it? Then you're going to end up in nutritional deficiency. So what are the ways? So you need to probably evaluate that. The fifth stage is maintenance. So you have achieved, say, 10 kgs of weight loss, and this has happened through a particular diet and exercise that you have done. And now you need to maintain it. So it cannot be, so it's a lifestyle change. It cannot be for 2 months, 3 months, 6 months. So how do you maintain that, and so that you don't slip back? And the last is relapse prevention. So I've done it, achieved it. Now, hush, and I can go back to my old ways and, chill. So again, to prevent relapse. So these are the stages. So at any stage, you need to first understand where that lady is and help her to. So showing this cycle really helps. This is where I stand. This is where I need to maintain. So I think professional help gives them more clarity and some support as well. Doing it all by yourself can be quite exhausting.
Absolutely, because what happens is many times they come to us, doctor, we don't want to go. There's a stigma even now. Though, of course, things are opening up. I don't want to go to a psychologist, or I don't want to go. Doctor, you only tell me what to do. So as gynecologists, we tell them that, okay, we are equipped to deal with certain things, but we cannot get into the basics and, help you further. So I think that is something which needs to be understood. And as Dr. Chaitanya very rightly pointed out, that the support system has to be there. If the child is coming, then the parents have to accompany, because it has to be a family affair, especially about eating problems. And the mother has to be kept in the loop. Every other person has to be sensitive that this person is trying to lose weight. Like we have, everybody knows about the Ambani family, how Mrs. Nita Ambani, when they had a problem with the child trying to lose weight, how she also incorporated the entire lifestyle, and it's working wonders. So it's a big example that how the family works and helps the person who is suffering. So that really helps.
Can I add?
Yes.
So I think when the lady comes or the young person comes to the gynecologist, I think giving that this is dealt with by a multidisciplinary team, if it is projected in that way, probably it may have a better, that this is part of what I need to do, rather than go across, come back after 2 days. I think that demotivates them.
True.
Yes. And sometimes what happens is, I see a lot of college girls, they have these mood elevating. Nowadays, we don't even know the names. So many things are available, mood elevating. Have this, have that. And I even know so many people who are not sleeping well because, anxiety or whatever, and they're having these melatonin tablets, and I don't know what all they contain. Sometimes I keep asking, what is this? How long do you take all this? They said, no, everything is available, madam. Aap bhi le lo. I'm wondering, it's the other way around. So one word of caution, I feel, that self-medication is something which, Dr. Chaitanya, do you also see such things? I mean,
Yes, quite a lot. So when I ask them, yeah, you have to take this, you have to take that, doctor, ये तो हम ले रहे हैं. I mean, from where have you taken? You have not visited anyone, but no, that's available, as you rightly said.
It's very. And do you see like all these problems? Do they impact fertility also? Because PCOS and infertility is something which is so much talked about. Women are not able to, conceive with PCOS. So how do you think, you can deal with these? Because they come to you as an infertility specialist, doctor, for 5 years I'm trying, but nothing is happening.
So, yes, as you rightly said, PCOS does affect fertility potential, and it's one of the leading causes of anovulatory infertility. Now, again, if you want to go back and see what happens exactly, that women with PCOS have got irregular menses, and we discussed that irregular menses at the back end, there is no ovulation, or there is no follicular development, there is no egg development, and there is no ovulation. So because of that, obviously there's going to be fertility issues as well, because if there is no egg, there is not going to be a pregnancy. For any pregnancy, you need an egg and you need a sperm. So without those two basic things, there is not going to be a pregnancy. So in PCOS, what happens is there is no follicle development, there is no egg development, and that is how it leads to infertility. Now, when the patient comes to us with PCOS and is having infertility, obviously, my step should be to induce ovulation. Now, when I say induce ovulation, it can be done by therapeutic ways like giving them some medications. But here, again, what happens is when the woman comes to us, she says, sir, my periods are irregular and that is why I'm not getting pregnant. I know. Somewhere I have read it. So make my periods regular and then I will get pregnant naturally, without doing anything. So they always come with the hope that the doctor will make my periods regular and then I will get pregnant on my own. So there again, counseling plays a very important role, because it's not going to happen that way. If I am going to give medications only for the regularization of the cycle, apparently they are not going to induce ovulation and she is not going to get pregnant with it. And then she is going to get her menses regularly till she is on those medications, if not helped by other lifestyle modifications. So even if I say that I'm going to treat the fertility, any management of PCOS always starts with lifestyle modifications for whatever reasons she has come to you. She may not have come to you for irregularity in the menses or for fertility issues. It starts with lifestyle modifications. Now, once she has adopted the lifestyle modifications, then I can think of giving her medications that can induce ovulation. There are different types of medications which are available in the market. For PCOS, letrozole is the most common medicine which we use. Maybe it's this because the program is for general public. It may not be right for me to go into the details of what all medications we use for it. But inducing ovulation and asking her to try naturally would be my first step. Now, if that doesn't work, then I would go to the next step of intrauterine insemination or IUI. And even if that doesn't work, then probably I would go to the third step, which is the in vitro fertilization or IVF step. So initially, we will always start with oral medications which will induce ovulation. Now, again, counseling becomes a very important part here because patients expect or the couple expect कि चलो मैं अभी ना डॉक्टर के पास आ गया हूँ तो I have started with the treatment. I should conceive in the first cycle or first month itself.
Yes.
Here again, counseling becomes a very important part. That it's a slow process. Human reproduction is the most difficult of all the species.
Right.
So you have to counsel them that you may not get pregnant in the first cycle itself. You might have to try for a few months. And then in spite of trying for a few months, if you don't conceive, we are going to go to the next step. It's always a stepwise approach. And you have to spend some time on each step. You cannot just, step first, step two, step three. It won't go that way.
Right, right. So one more thing which they should understand that PCOS is a lifelong condition. Sometimes
Absolutely.
they say 5 years back I had PCOS, but you should understand it's a lifelong condition. There are something like remissions and exacerbations, but it is like, something process that has to be completely, you have to keep working on it.
Yeah,
that is very
that's where Dr. Prajakta's advice would come handy. That once you have reached there, you have to maintain it as well. So if you maintain it, then your regularity in the menses or fertility is also going to be maintained. If you go back on what you were doing before, obviously the things are going to go back where they were or where they started.
Very true. So with that, I'd like to ask Simmi, what are these environmental toxins basically, which contribute to PCOS? If we see, we are like eating all kinds of food nowadays, which is, got so much of chemicals and, preservatives. So could you tell us a little bit in detail, what are the toxins which are there in food and their detrimental effects?
Yes, so this, as we know, PCOS is related to the hormonal disruption, right? So these EDCs, endocrine disrupting chemicals, they are found abundantly in all these foods. With this advancement in technology and industrial, they are commonly found, in the food, pesticide, fungicide, plasticizers, packaging, and all that. They disrupt not only the hormone production, but their signaling, their action, binding, transportation, elimination, everything. Okay, they have their impact on the pathways which converge with the reproductive and endocrine system. So most notable and most commonly studied ADC is BPA, that is bisphenol A, which is present in the plastic, which is commonly found in epoxy lining of metal-based food beverage cans, thermal paper cups, water pipes, etc. It can leach into food and beverages with the repetitive use. So it's very important that even at very low concentration, it can combine with ERs, that is estrogen receptors, and ER-dependent transcription, causing negative health effect. Strong causal effect it has with inflammation and decline in the ovarian reserves. Another very important is plasticizer, or you can say microplastic, nanoplastic. So these are plasticizers, phthalates. They are used to make the plastic more elastic and more durable. So they just leave the plastic and they get mixed into the food. So this is something called, they have the interaction with the food. So if we store the hot foods or very strong acidic foods like pickles and all that in these kind of, which is non-food grade plastic, then it has got that this microplastic, nanoplastic gets leached into the food, and that is how it is found in sea salt, sea foods like fish, shellfishes, from the polluted water, tea bags, honey, milk, and even breast milk. This microplastic and nanoplastics are found. Okay, then there are something like parabens, butyl and propyl parabens. They are commonly utilized in the foods like sauces, jams, soft drinks, salad dressings, mayo, baked products, frozen dairy products, all this. And they also have the effect on nuclear receptor of hormones like estrogen. And but the more human studies are still needed. Then there are heavy metals like mercury, arsenic, lead. They are also found in fish, fertilizers, etc. So the food is grown in that kind of belt. Then the altered level for these heavy metals are found in the girls with the PCOS, and they have the negative impact. They cause more oxidative stress, metabolic and hormonal changes. And one more thing I would like to throw light upon is the AGEs, that is advanced glycated end products. So they are formed through the Maillard reaction. That is like over processing of the food, over baking. Like these days, we do get those dark chocolate colored biscuits, or coffee biscuit, those microwavable popcorn and etc. Then there are N-nitrosamines found in the curated fish, meat, overheated meats and fishes. So they all are formed in these kind of foods, and they also have the negative effect on the ovarian steroid production, which also leads to obesity, IR, and hyperandrogenemia. So study about this AGEs, advanced glycolated end products, it emerged from HbA1c, glycated hemoglobin. So they started, studying about these, and they found that these products also have the negative effect on these hormonal, and they disrupt the hormonal cycle. So tips would be store the food in glass or stainless steel, especially hot foods and pickles. Don't microwave the food in the plastic, or at least use a food grade plastic. Choose BPA and phthalate free plastic. Avoid reheating, reprocessing foods at very high temperature. Prefer freshly prepared homemade food. Buy from a reliable source with a rapid turnover. So we usually have this practice of using those, packaged water bottles very repeatedly. And you should never keep these bottles. Tend to keep them in the car, and then car is standing under the sun. So these have this food interaction, plastic leaches into the food. So we should never have this practice. So these are the environmental toxins that do have the effect on development of PCOS.
I think that was very, very elaborate again. So we have 2-3 questions pertaining to that. Mrs. Swati Patel and Ashwini have asked about plastic and PCOS and microwave and junk food, and also I think you answered these 2 questions very elaborately. So later on we will not be taking them, because she's just told them as to how food grade plastic, if at all, for the microwave. But preferably it is always better to do glassware.
Glass and stainless steel.
Very important take-home message, I think. And with that, we go on to Dr. Prajakta. Now, we are seeing so much of PCOS. So, do you think there is a need for us to sensitize schools and colleges about PCOS? And any tips which you can give, to improve the mental health in PCOS? Stress management techniques, because now I think we are running short of time. So, we'll just take one question each. Any good techniques which you could elaborate on?
So I think general awareness has to increase in younger population. See, because I think those are the people where this social pressure and all this is more. And I think the whatever mental health issues may come up, they are more in the forefront, not after you're married or you're already in a job. So it's, I think, young teenage and early adulthood are very, very fragile in mental health when they are facing with health issues as well. So I think that population needs to be targeted. So institutions, so work institutions and colleges need to be sensitized, and not only the faculty, but also students, where so they are more sensitive to people who are suffering from PCOS, or they don't become victims of bullying or bickering, or they are not inclusive to such people, or they marginalize them. So I think sometimes giving a buddy, if a person is identified, involving the school or college counselor, and getting somebody to look over, or watch out. So if there are 2-3 people watching out, then some amount of bullying or bickering or all that is taken care of, and that person is kind of shadowed, or so it helps. So I think this we do for other things as well. So people with other say young students with learning disabilities or ADHD, so we give buddies. So I think school and college counselors also have to be in the loop. For stress management, I think so, because it's multifaceted. We cannot expect the young person to do it on her own. So so parents need to be involved, or family needs to be involved and told that they need to take help, maybe with diet, or with exercise, or with mental health. So a counselor, or for stress management, if somebody is helping, it helps to even ventilate. I think getting it out of your system is a good way of feeling better. And because I think it is very unnerving and isolating. Where do I go and talk about all this, and what can be done about it? So I think so apart from looking after diet and exercise, which Simmi madam has talked about, there are few things like meditation or pranayam that needs to be incorporated. So because the anxiety is so high, what we need to give them the parallel of a marathon. So if I was asked to say run 5 kilometers or 10 kilometers today, I will not be able to do it if I'm not practicing. Simmi madam, you will be able to, I know, because you're practicing. So but if I'm told, say 3 months down the line, I have a marathon to run, then I will practice, build up my stamina, condition myself to that kind of running. So it's the same way, anxiety, you cannot be in an anxious situation and expect deep breathing exercises to work. You have to practice it to be able to extrapolate it to an anxious situation. So it's kind of a training that you need to do. Hence, pranayam and meditation daily. Having some hobbies. So because it's very isolating, cultivating 1 or 2 hobbies which kind of are able to help them stay rooted, being comfortable on their own, or being happy with their own company and doing something productive. So it could be anything. Say painting, reading. People with mental health issues, I usually ask them to carry a book, book that interests you. So there's nothing to do, no one to talk to, sit with the book. Or if you like doodling, carry something small. So it helps, you don't feel lost. Avoiding impulsivity. So usually if that is the normal graph that all of us are on a mental health level, then they are two levels lower all the time. So from time to time, to, like you said, to be able to feel better, they end up getting into poor coping mechanisms like substance or impulsive eating, or say alcohol, smoking. So you need to be able to identify that these behaviors are catastrophic. The young girl may walk, run, and do things for 10 days, but one impulsive binge is going to take her down. So to be able to avoid and to make her understand that mood and food are not related.
Right.
If mood is low, you can't go to food. You have to find some other mechanisms. So that connection has to break. And when it is getting too difficult, to take help. So it could be a friend. It need not be a mental health expert. You have to talk it out. You have to at least say, I need help. So I think that itself will, I think, pave the path for, people to come up, and if there is awareness, yes, she will get help.
Definitely. I think, you have more or less answered, because there's a long question by Mr. Arijit Sen, and all of this you have answered in this, because, he's written what are the strategies, initiatives, especially in corporates, for relaxation techniques. And also now we have so many redressal forums also. I think this burnout and all these things which we keep hearing. So like you said, relaxation techniques, taking a hobby, group activities, not only in school and colleges, even at workplace, we can have, like even in our hospital, we have, we celebrate Women's Day, we have when women get together, or even other consultants, we have these get-togethers, and we do so many things. So I think that is a good atmosphere, and you are now amenable to suggestion. If people come and talk it out, then there are people who are there to help you. So I think that's a very, very important point. And to Dr. Chaitanya, there are some questions regarding metformin and lean PCOS, because since we are running short, so people want to understand metformin, is it given, and do people have lean PCOS, because we keep hearing about obese PCOS all the time.
Yeah.
So
yes, there is
to answer that.
Yeah, there is an entity called as lean PCOS, wherein there is presence of PCOS, but is no obesity. Of the two, I would say lean PCOS is more difficult to treat as compared to an obese PCOS, for sure. And as far as metformin is concerned, see, the hallmark of PCOS is insulin resistance. And metformin helps to reduce that insulin resistance because it's an insulin sensitizer. Therefore, metformin is given in women who have got insulin resistance. But do you ask me, if someone asks me, do you prescribe it to each and every woman who is having PCOS? No, I won't. We need to document that there is an insulin resistance in that particular woman, and only after that I would suggest to go ahead with insulin sensitizers. So metformin is one of it. Myo-inositol is another insulin sensitizer which is quite commonly used nowadays. And if she's having insulin resistance with obesity, then GLP-1 agonists like liraglutide, semaglutide could be of help as well. So there are quite a few drugs which are available to reduce the insulin resistance and improve the insulin resistance. Those can be of help surely, but as I said, not in all of them, only if she has a documented insulin resistance.
So, like we are just finishing now, so we'll finish with the Simmi in the end with nutrition. So before that, I would like you to tell us about the long-term risks which are associated with PCOS, especially, cardiovascular risk and endometrial hyperplasia, and what should be done, means what kind of testing, surveillance would you recommend to all women?
So there is something called as a metabolic syndrome, which is associated with PCOS. So this metabolic syndrome consists of hypertension, number one. So blood pressure could be high. Number two, the blood sugar levels go haywire. So she is prone for developing diabetes in future. Then comes the cardiac risks. So they are more prone to have cardiac issues or cardiac problems other than hypertension. Then there are sleep disorders which they are associated with, and then the endometrial hyperplasia and the endometrial cancer risk which is associated. As I said in the first question when I answered, that there is an unopposed estrogen action which leads to this endometrial hyperplasia and eventually leading to endometrial cancer. So all this collectively is called as metabolic syndrome, and that is associated with PCOS. And therefore, one thing what I would like to suggest or say is that don't leave that woman with PCOS once she gets pregnant. Many a times they come to us either in the adolescent period when they are having irregularity in the periods, or the second time when they present to us are with infertility issues. And what we do is we treat their infertility. She gets pregnant, she delivers, and she is lost to follow-up. There we have to be careful and we have to counsel her that this is a long-term thing. It's not just that you have overcome the fertility issues and you have now got a baby. That's the end of it. No, the metabolic syndrome is going to be there with you if we don't correct that PCOS. So the lifestyle modification should continue. The pharmacological treatment, if needed, should be continued. Weight loss also needs to be continued even after she has achieved. So these are in between victories. So you have not won the war yet.
Yes.
So you have a long way to go before you win the war. And if you have to win the war, you have to be on the battlefield. You cannot be sitting at home and saying, "यार कोई तो जीत लेगा मेरे लिए."
So consistency is the key. That is very important. That's a very, very important message which you have given. First of all, regular health checkups. Don't be lost to checkup and continue to work on whatever is the, factor. So with that, I go on to Simmi. Simmi, there are so many myths, about diets and, there is so many fat diets. And so I'd like you to tell us a little bit about these diets and also what will be your nutrition prescription in detail. So if you could sum it up in both these things, so that will be great.
Yes. So these, fat diets like OMD, ketogenic diet, intermittent fasting, they may lead to, they may give you kick and jump start, quick weight loss in short term due to caloric restriction. They may increase the motivation and discipline also. They can help reduce calorie intake by limiting the food choices. Then they improve the eating habits by encouraging people to focus on the healthier food choices and like cutting out processed food, alcohol consumption, etc. But they may also cause nutritional deficiencies due to the restrictive food choices, hormonal imbalancing, affecting metabolism with hunger hormones, then quick but unsustainable weight loss. So we should be looking at the sustainable scientific weight loss without any nutritional deficiencies. That is very, very important. There may be the increased risk for eating disorders, then could be muscle, hair loss, hormone disruption, dull skin, etc., lacking the stamina and energy. So all these negative impact these fat diets can have. So they can often promise quick fixes, but they can be detrimental to overall health and sustainability. However, if combined with the research proof, evidence-based diet like Mediterranean diet and all that, they and done under professional qualified dietitians guidance, they can yield excellent result. Okay. So my nutrition prescription would be eat everything, but in moderation. Okay. And the take home message will be it's a multiple modality management. So diet, exercise, sleep regimen, lifestyle behavior modifications. I would just like to give sweet, short, crisp quotes. Rang de basanti, no nutritional deficiency. Diet diversity, runaway obesity, start resistant, shoe insulin resistance, enrich eubiosis, step up symbiotics, antioxidant bowl, ROS brawl, food safety, fit and healthy, fade away fats, portion control plates, takeaway conclusion, caloric restriction, eat in moderation, control F, shift delete, eat, sleep, run, repeat. Let's go PCOS, that is platter, colorful, organic, sattvic.
My God, Simmi, I think I'm going to approach you for a film. You have to make a film for us. This is so effective, and I think this was beautifully said. Very, very, very elaborate, very beautifully, very lucid. Thank you so much for all these lovely take-home
So
messages.
I do have the comparative data if we have the time, some like calorie composition between healthy food and junk food.
So what we'll do is we'll put it up, all these things, we'll ask you to put it up and we'll put it on our website.
Sure.
So with your permission, if we can put it on, because we have a very vibrant PCOS website and it keeps getting updated every week, So we'll definitely put all these things because it will benefit our audience. And we do have a lot of, reels and we have a lot of videos for every single thing. So my team will get in touch with you and it would be really, we benefit a lot from your expertise.
And recipe makeover, and most important is the attitude shift. So have a look at your plate and think, this is what I see, I want to feed myself. And I'm sure you will discard whatever unwanted, unhealthy stuff from your plate. Attitude shift is most important.
Attitude
Prajakta,
shift.
madam.
So Prajakta, I would like you to sum that attitude shift. What could you add to that attitude? How does it, how do we help the attitude in the end? You are what you eat is what we hear. Positivity is what we hear, but how would you put it?
So I'll not be able to sum it up in one line. What I suggest is, I think setting small goals is very important, and taking help, talking about it is very, very important. You don't have to deal with it on your own. There are many, many people out here to help, but you need to take help. You have to say, I need help. and you will get some or the other way. I mean, even if you were to put it on Google, there is so much to help, but you need to be open to help and take it, because they suffer so much, they are close to suggestions. So I think that has to break.
And for that, we have to practice what we preach them.
Yes.
I think Prajakta, that was
so I always keep on saying, now it's time for us to embrace the old way of living, what our ancestors used to live like a few generations back. Discard the plastic, embrace again the old way of having those
cloth bags and all those
And so food safety is very, very important. So for that,
मिट्टी के बर्तन जो हुआ करते थे, those kinds of things, we have to go back there now.
Absolutely, we have to go back to our roots. We have to reanalyze where we are going wrong, because as we all know, climate change, everything is boiling down to climate change, because whatever is around us, it impacts us. So definitely we have to look in within and as well as without, and then see how we can make a difference. So with that, I would like to thank our panelists. I think we've answered all the questions also in the chat box during our process of conversation. And over to Kunj. Thank you so much, Dr. Chaitanya, Simmi, and Dr. Prajakta. Thank you for being with us. And I'll ask Kunj to give you the thank you slide in the end. So we thank the Vijayata team who has brought us this entire session, who's worked very hard with a grant from Philips India. And you could please reach out to us for any further questions. We have put the numbers here. You can contact us on 915-2919-221 or manager.vijayata.pcos@gmail.com. So we'll be happy to get back to you. And with that, thank you so much. Be a winner, deal with PCOS, and you will come out shining. Thank you.
Thank you, Dr. Sandhya.
Thank you.
Thank you, Prajakta and Simmi. It was a wonderful discussion.
Thank you.